But first at 4, the Omicron variant has officially arrived in the United States.
The CDC says a case was detected in a person in California who returned from South Africa. The individual, who was fully vaccinated but had yet to receive a booster shot, is said to be experiencing some mild symptoms.
This comes as here in Rhode Island, Governor Dan McKee says the Test to Stay program in westerly schools has been a success.
The governor says other school districts can implement the program, especially as data shows cases have risen sharply amongst younger Rhode Islanders. 12 News reporter Alexandra Leslie joins us live now from outside the Department of Health with more details on what health officials had to say today. Alex?
Welcome, and Shannon, the state is opening up this Test to Stay program to any district in the state who wants to try and use it. And they say after school officials in Westerly say about 315 school days were saved as a result of this program first announced back in September.
Test to Stay.
2 months later,
the Westerly pilot was a success.
Governor Dan McKee says the program, designed to prevent students from missing class due to quarantine, saved hundreds of school days in the process, but it also kept kids safe.
No one tested positive following exposure to a Test to Stay positive contact.
The success of the program comes amid rising COVID-19 cases across all age groups, but particularly among children.
Between Halloween and Thanksgiving, the case rate among children 5 to 9 has doubled, and it has tripled among children 10 to 14.
Governor McKee says Rhode Island has vaccinated almost 20,000 kids ages 5 to 11, with about half of those appointments taking place in school-based clinics. But the health department director says more needs to be done to boost vaccinations among all eligible children.
There are roughly 200,000 children in Rhode Island, and most of them are still not vaccinated yet.
In an effort to do so, Dr. Nicole Alexander Scott says Rhode Island will be offering more COVID vaccine clinics for kids 5 to 11 this month.
Like everyone in Rhode Island, families with children still need to be vigilant. The best step in terms of vigilance is getting vaccinated.
At the top of the hour, you said that that new variant has been detected in California. Health officials here say it has not yet been detected here in Rhode Island. Shannon?
Now, Alex, we also understand the governor addressed the development of what the health department refers to as a health smart card. Can you tell us more about that?
Yeah, so other states have been calling this a vaccine passport. Governor McKee told me you can call it what you want, but that it's a smartphone app that is designed to store a vaccine card as well as test results even. But we're told that this is not a requirement, and rather it's an alternative to that paper vaccine card that people have, and it'll hopefully be an easier way for people to travel both domestically as well as internationally. Again, the state is testing this app. They say it's not a requirement. They're testing it, but they hope to have it roll out in the next couple of weeks. Reporting live in Providence, Alexandra Leslie, 12 News.
Rhode Island state health officials say the Omicron variant has not yet been detected here, but they are continuing to sequence positive PCR tests in an effort to find out if it is.
12 News reporter Alexandra Leslie was at this morning's briefing on COVID-19, and she joins us now live with what the state is saying about masks and the ongoing vaccination effort, which now includes the development of a new health smart card. Alex?
Well, Megan, Shannon, amid high community transmission of COVID-19, reporters have continued to ask Governor Dan McKee for weeks now if he's considering re-implementing a mask mandate. And he was asked again this morning, just hours before the news broke about that new variant arriving here in the U.S. For now, Governor Dan McKee says he's not re-implementing a mask mandate for Rhode Islanders.
We're in a position where we're just going to keep it the way it is.
That is, requiring masks in schools, hospital settings, and on public transportation. But the state's high level of community transmission...
It's clear that COVID-19 is still very much with us.
...has prompted state officials to keep encouraging the use of masks.
Wear a mask anywhere. If you're indoors, certainly if you're in a crowded place, and especially if you're at higher risk. Mask wearing is incredibly important.
Governor McKee says about 20% of Rhode Islanders are wearing masks in public where they're not required. However, the state's adult population is largely vaccinated.
Almost 95%, what I saw this morning, of Rhode Island adults have received at least one shot.
In an effort to make it easier for Rhode Islanders to keep track of their vaccine record, especially when traveling, state officials announced the development of a smartphone app that will store their card digitally. The executive director of the state's COVID response team says it's something the state has been working on.
We're really hopeful that in lieu of that official federal standard, this will fit that bill. So where we are right now is we're actively in user testing, so awaiting some feedback here in just the next couple of weeks. We'll be ready for a larger rollout.
Now, we're told that smart card app, it's not a requirement, but again, it's just an alternative to the paper vaccine card. State officials also say that they're making more booster clinics available this month, and they're also encouraging Rhode Islanders 18 and up to get that booster shot when they're eligible. Reporting live in Providence, Alexandra Leslie, 12 News.